Hi, this is Dr. Jason Dulac coming to you from my office, Dulac Dental in Springfield, Virginia. We get a lot of questions about gingivitis. Today, I want to answer some of those questions for you. What is gingivitis? Gingivitis is gum inflammation. So anytime you're brushing or flossing, you have spot bleeding in the gum, that's some localized inflammation. Totally normal to have little spots of gingivitis here or there, especially if it's been a little bit since you've had a cleaning or you haven't been routine about brushing and flossing. What we want to prevent is generalized gingivitis, so gum inflammation everywhere. That's a sign that you're either not doing what you should with your home care or you're not coming in frequently enough for cleanings. So the plaque, the fuzzies we get on the teeth if we haven't brushed in a while, it's a layer of bacteria. And that bacteria release toxins, and the toxins cause gum inflammation and bleeding, and that's what gingivitis is. So if the gums hurt, it's from the inflammation from the toxins that are being released from the bacteria that are on the teeth. So the gums shouldn't hurt or bleed if they're healthy. If they are bleeding, there's a couple things you can do. On the home care side, I always recommend a Sonicare toothbrush. The vibrating action of the bristles really helps break up the plaque well. It's the best brush on the market, in my opinion. Oral-B is a great brush as well, but Sonicare is just a little better. I've used both. I always recommend Sonicare to all my patients. The other thing is flossing. Only about 10% of the population flosses. A lot of the problems with teeth start between the teeth where the toothbrush can't reach. So the Sonicare to get the top, the tongue side, the cheek side, but right between the teeth where the toothbrush can't reach, you got to get in there with something. Personally, I like floss. You can use floss picks, you can use a water pick, you can use the go-between brushes, but I like floss. With routine brushing and flossing and routine maintenance, gingivitis shouldn't get out of hand. You know, we've all had that time where like a popcorn kernel or something gets stuck in, gums bleed for a little bit and goes back to normal. When the gums are bleeding, it's actually a sign that you need to brush or floss more, not back away from it and brush less. So if you have a little spot bleeding, go after it with the toothbrush and the floss. If that's not getting you where you want to be, give us a call at the office. You might just be due for a cleaning. What we want to prevent with gingivitis is it progressing to periodontitis, which is gum disease. So that gum inflammation, if left untreated, can lead to gum disease, which is the bone pulling back away from the tooth. If you have any questions about gingivitis or gum health or need to schedule a cleaning, please give us a call at the office, 703-451-4500.